Lori Waldemer Lord was diagnosed with an autoimmune disease at age 30. Over the last 17 years, her condition worsened.
It got really hard to function every day. And my main doctor told me it was probably time to start talking to a transplant team.
Preparing for a liver transplant is tough enough, but Lori had to prepare during the pandemic.
Because I knew if I got sick, I wouldn't be able to get my transplant. So I did everything possible. And I really think that during this time, it made things easier for me. Because we all were taking extra measures to be careful.
While COVID has pressed pause on certain procedures and doctor's appointments, it's had the opposite effect for transplants at Intermountain Healthcare.
We've actually had an increase in the number of transplants, and that's because other programs had a decrease in the number of transplants during COVID, sometimes because of the surge and sometimes because of other reasons.
COVID screenings are required for both the patient and the donor. A transplant cannot happen if the recipient gets COVID. Intermountain Healthcare also updated their procedures and offered virtual appointments.
If we stopped transplanting people, more people die. If we have more donors and more people willing to donate, more people live. We cannot break that part of the cycle.
A week after the surgery, Lori was out of the hospital and feeling great.
I feel like I'm back in my 20s.
Sharing one last reminder: be a donor if you can.
Without the sacrifice of donating, I wouldn't have a second chance at life.
Jessica Taylor, Idaho News 6.